Pyelonephritis, a common kidney infection, is complex and poses challenges in diagnosis and management. This video explores its pathogenesis, classification, diagnostics, treatment, complications, special populations, and surgical interventions. Impact on kidney function, prognosis, and long-term outcomes are also discussed. Pyelonephritis results from bacteria traveling from the lower urinary tract to the kidneys. Bacteria stick to the urinary tract lining, produce toxins, and evade the immune system. Common culprits: E. coli, K. pneumoniae, P. mirabilis, and E. faecalis. Host defense mechanisms, like barriers and immune responses, help prevent pyelonephritis. Understanding how bacteria and host defenses interact is essential to understanding the disease. Pyelonephritis can be classified into acute uncomplicated, complicated, and chronic categories. Each category has unique characteristics and implications for treatment and long-term outcome. Understanding the classification is important for proper management of the condition. In diagnosing pyelonephritis, ultrasound is commonly used first for its availability and safety, but has limitations in detecting inflammation. CT scans offer better accuracy but involve radiation and contrast. Nuclear medicine techniques like DMSA scanning provide functional assessment. Choice depends on the clinical situation. In the video on antimicrobial therapy for pyelonephritis, we discuss the importance of selecting the right antibiotics based on local susceptibility patterns, infection severity, and complicating factors. Empirical therapy with fluoroquinolones, cephalosporins, or trimethoprim sulfamethoxazole is common, but individualized therapy is preferred once the causative pathogen and its susceptibility are known. Complicated cases or infections caused by resistant organisms may require broad-spectrum antibiotics and consultation with infectious disease specialists. Close monitoring, dosage adjustments, and timely switches to oral therapy are crucial for successful treatment. The emergence of antimicrobial resistance poses a significant challenge in the management of pyelonephritis. Common uropathogens, such as Escherichia coli, have increasingly developed resistance to many commonly used antibiotics, including fluoroquinolones and trimethoprim sulfamethoxazole. This necessitates a shift towards alternative agents, such as extended-spectrum cephalosporins or carbapenems. The identification of resistant pathogens via culture and sensitivity testing is crucial for tailoring antimicrobial therapy. In addition, the implementation of rational antibiotic prescribing practices, antimicrobial stewardship programs, and infection control measures are pivotal in combating antimicrobial resistance. Collaboration between healthcare providers, microbiologists, and pharmacists is essential for optimizing treatment strategies and minimizing the spread of resistant pathogens. Recurrent pyelonephritis, characterized by repeated episodes of kidney infection, necessitates a thorough evaluation to identify underlying causes and guide long-term management. Potential factors contributing to recurrent pyelonephritis include anatomical abnormalities, functional abnormalities, calculi, urinary tract obstruction, and impaired immune responses. Timely interventions, such as surgical correction of anatomical abnormalities or stone removal, are often required to prevent recurrent infections. Prophylactic antibiotics, intermittent self-catheterization, or long-term suppressive antibiotic therapy may be considered in select cases. Additionally, patient education regarding proper hygiene, voiding techniques, and fluid intake plays a crucial role in preventing recurrent episodes. Pyelonephritis in special populations, including pregnant women, children, the elderly, and immunocompromised individuals, requires prompt diagnosis and appropriate antimicrobial therapy to prevent complications. Unique considerations in each population must be understood for optimal patient care. Renal abscesses, uncommon but serious in pyelonephritis. Infection spreading into renal parenchyma forms pus-filled cavities. Symptoms include fever, flank pain, leukocytosis. Diagnosis with imaging, ultrasound, CT. Antibiotics and drainage needed. Collaboration between specialists crucial. The complications of pyelonephritis include sepsis, renal scarring, papillary necrosis, and renal failure. These can lead to life-threatening conditions like septic shock and multiple organ dysfunction syndrome, as well as impaired renal function, hematuria, and kidney disease. Prompt diagnosis and treatment are essential to prevent these complications and preserve renal function. Post-infectious glomerulonephritis, PIGN, is an immune-mediated complication that can arise following pyelonephritis. It typically occurs due to the deposition of immune complexes in the glomerular basement membrane, leading to glomerular inflammation and subsequent renal dysfunction. PIGN can manifest with hematuria, proteinuria, hypertension, and acute kidney injury. Identification of underlying infections and prompt initiation of appropriate antimicrobial therapy are crucial in the management of PIGN. Supportive measures, including blood pressure control and fluid management, may also be necessary. In rare cases, immunosuppressive therapy may be considered if significant renal impairment persists. Close monitoring and long-term follow-up are essential to assess renal recovery and prevent chronic kidney disease. Surgical interventions for pyelonephritis include minimally invasive procedures like percutaneous nephrostomy or nephrolithotomy for drainage of infected urine and pus. Nephrectomy may be needed in severe cases with irreversible renal damage. Collaboration between specialists is essential for decision-making. The prognosis of pyelonephritis can vary depending on several factors, including the severity of infection, promptness of treatment, presence of complications, and underlying comorbidities. Early initiation of appropriate antimicrobial therapy and timely management of complications play a crucial role in preserving kidney function and preventing long-term sequelae. Recurrence risk can also vary based on factors such as anatomical abnormalities, functional abnormalities, and immune status. Long-term outcomes may include persistent renal scarring, hypertension, chronic kidney disease, or recurrence of infection. Close monitoring, regular follow-up, and patient education are key components of comprehensive management aimed at optimizing outcomes and preventing disease progression. In conclusion, pyelonephritis is a complex and important disease that requires a deep understanding for proper diagnosis, treatment, and prevention. By staying informed and working together, healthcare professionals can provide the best care for patients with pyelonephritis.